Patients will come to DXP imaging because generally for medical imaging, to take pictures of a problem inside the body, a CAT scan, MRI, X-ray, ultrasound, mammography. Many patients are also sent to DXP imaging because we are the region's leading experts in the diagnosis and the treatment of P.A.D. And generally that's diagnosed first with a test called an ultrasound or a Doppler test. So many times your doctor will send you to us to get an ultrasound or a Doppler test to determine whether or not there are any blockages in the arteries.
We have one of the most advanced and well-trained vascular components. So we do a lot of work in the body opening arteries that are blocked to help people whose legs hurt when they walk to walk again, to help kidneys and other organs that are not getting enough blood get enough blood to function properly.
If a patient or a family member has the symptoms of P.A.D., we have peripheral artery disease specialists right here at DXP Imaging. And the majority of our patients actually come to the window and schedule an appointment. And generally an appointment can be scheduled within a week. Patients with P.A.D. generally will undergo a procedure called an arteriogram or a catheterization. And most patients are familiar with this concept because they've heard of a catheterization of the heart. Well, we do catheterizations of the legs. It's pretty much a very similar thing. It's an outpatient procedure where a very small tube is threaded into the artery at the top of the leg. And this is done under just mild sedation, not anesthesia. That catheter is then threaded to the artery that's blocked using a big X-ray machine to show us where we're going. And then there are several ways that we can fix that blockage through that little tiny hole, which is about 1/4 of an inch in diameter. The first is called an angioplasty, which is a balloon that goes through the blockage and pushes it aside and allows the blood to flow down the artery to the leg. The second is called a stent, and the stent is a metal tube that forces open the wall of the artery and allows the blood to go down the leg again. The third is something called an atherectomy, and most people refer to it almost as a roto-rooter type device. And there are several different types of devices. We're actually the first people in the region who have used these devices when they first come out, and we're actually a test site for the latest devices that open up these arteries using that technique. And generally that is placing a small device through the blockage and either removing the blockage and taking it out of the body or boring a hole through the blockage. Again, all of this is designed to open up the artery, get the circulation to the legs, and to do it through a very tiny hole. When we're done, the patients get a Band-Aid, and they generally go home within 2 to 4 hours, and the next day they can resume normal activity.